Elbow impingement. Anatomy. Elbow impingement will show itself as posterior elbow pain. It is considered to be the compression and damage of the soft tissue or cartilage of the posterior elbow. Elbow joint is created by the articulation of three bones, the humerus, radius, and ulna. Shock-absorbing cartilage lies between these joint surfaces to allow for articulation between these three bones. Pathology/signs and symptoms. You'll find pain in the posterior aspect of the elbow, point tenderness of that area. Those with minor cases of elbow impingement can continue with their physical activities, but they will experience increased swelling, pain, and stiffness of the elbow. Patients may also experience a loss of elbow movement, specifically losing the ability to straighten their arm into full extension. This can also be shown as radial or ulnar nerve pinching. Mechanism of injury. Posterior impingement is due to overuse and repetitive forced extensions of the elbow. This will be during your overhead racket sports, swimming, boxing, and during your throwing mechanism. Also caused by a blow to the olecranon process, causing to jam it into the olecranon fossa of the posterior elbow. This will result in inflammation of the area as well as injury to the cartilage and the bone. Special tests. The first three special tests are mainly focused on elbow impingement. Elbow extension test is when if you can't fully extend your elbow, that's a positive sign for elbow impingement. The next two are pretty self-explanatory. The push-off test will be done on a wall with two hands. Then the last two are focused mainly on carpal tunnel syndrome, but they can also show signs of impingement. There are three main predisposing factors: structural deformities of the elbow, improper biometrics, improper technique in sports. These last two typically go hand in hand, especially with your throwing mechanism. This is a combination of management and treatment, referral and immobilization, and rehabilitation. Typically with this injury, you can take medication as well as ice the area, but it typically does not need surgery. Physical therapy focuses on muscle strengthening, flexibility, and range of motion of the elbow. Corticosteroid injections can be used to treat inflammation as well as swelling. Surgery is only necessary if these treatments are not successful or there's catching due to floating bone fragments within the joint, which would cause you to not go into full extension of the elbow. There's a 3-month recovery time after surgery. There is not much to do to prevent this type of injury. You could possibly pad the area to prevent the blunt force aspect of the injury, but it will not help with the hyperextension aspect. There is no Mulligan technique for posterior elbow impingement. This is my PICOT analysis. Population, 36 consecutive patients, 34 male, 2 female, 7 professional athletes, 6 college athletes, 23 high school athletes. Intervention. All patients tested positive for posterior elbow impingement pain, causing limited activity in pain and extension. Comparison. Comparing to see if arthroscopic debridement and other surgical procedures are safe and if they allow for the patient to return to previous level of function. Outcome. Significant improvements were seen in pain, motion, and function. No neurovascular complications were seen related to the arthroscopic debridement. 35 of 36 patients returned to previous level of activity with no pain, including the professional athletes, showing that this is a safe procedure and it will bring them back to previous level of function. Time. Patients underwent follow-up visits at a median 51 months with a range of 14 to 81 months. These are my references.